the level of recovery, the ability to have a relationship, a job, to be normal. This is what I want for the rest of the community. All I'm saying is take the most effective treatment, use it in the most effective way, be kind, be competent, be available. And how are we going to do this?
We first had Dr. Robert Laitman on the podcast in Season 1, Episode 18, and it's still one of our most listened to episodes. His approach and his book, Meaningful Recovery from Schizophrenia and Serious Mental Illness with Clozapine, has helped so many. And his wish, and the next step, is to make that kind of treatment available to more people with the help of Doro Mind. Welcome to our podcast, Schizophrenia, 3 Moms in the Trenches. From the place where schizophrenia and real life collide. East Coast, West Coast, Middle America. With Miriam Feldman, Mindy Greiling, and Randy Kay. Welcome to our 107th episode of Schizophrenia, 3 Moms in the Trenches. I'm Randy Kay here with Mindy Greiling and Miriam/Mimi Feldman. We're 3 moms who've written 3 books about our experience with a loved one, in this case, our sons, who all have schizophrenia. And we're turning our pain into purpose with this podcast. And if you're new, I want to welcome you, first of all. I know there's a lot of back episodes to listen to, but in a moment, I'm going to let you know what the most popular ones have been. And we're delighted on this episode to bring back, in a moment, Dr. Robert Laitman, who is among the top 10 of our most, actually number 7 in the top episodes listened to, watched on YouTube, and he has a lot to share and some exciting news. So we're going to bring it back. If you've been listening to the podcast, hi, Mindy. Hi, Mimi. Just want to say, so Mimi's, muting to cough. I'm going to be muting to cough. It's late.
I don't have a cough. I guess I'm the cough-free person today.
You can keep your microphone on then. I've just returned from Chicago, and I'm sure that the air travel didn't help my sinuses or whatever this is that has been going on since I had COVID 2 years ago. We will get to the bottom of this, which is what I often say about my son's illness. So my son, Ben, as I mentioned, has schizophrenia. Right now, we're in a crisis because he is in supported housing and not accepting the supports that are available to him, because substance abuse has clearly entered the picture. And if he was unreasonable before, he's certainly unreasonable now. And I just want to say that we had a huge crisis a few weeks ago that I believe any intelligent person would say, oh, this person is a potential harm to himself and a potential harm to you, Randy Kay. And it's a few episodes back. If you want to hear the harrowing details, I also wrote a blog about it on Substack. Just look for Randy Kay, or you can go to my website, randykay.com. It's all in the show notes. But this involved an episode where he was so desperate for money that he actually ran after my car, opened the car door, tried to get in, stop the car, and sit in my lap, and ended up falling out of the car, knocked to the ground. I was in danger. He was in danger. And right now I'm talking to mobile crisis unit, because this isn't arrestable. He just got a disturbing the peace charge, and they're going to come out and check on him today. But what I got over the phone was, does he have suicidal ideation? If not, he's not.
I hate that.
I know. I mean, he's not sick enough. I got this. I have a whole chapter in my book, Ben Behind His Voices, called Not Sick Enough, because to me, this is a harm to himself and others. To me, taking in an unofficial occasional roommate, his brand new furniture has rips in it. His bed is being slept in by someone else. The brand new apartment we moved him into is in horrible shape, and I want him hospitalized. I want him detoxed. I don't know what it'll do, but it'll be something. Anyway, but I'm not, it's not like, oh, yes, we will give him a 72. No, I literally got, we have to protect the patient's rights. And so I'm back there again. I'm sure many listeners will feel that same frustration because you've probably been through it too. I'm back there again. Oh, we have to protect his rights. And I said to the guy who was very nice, I said, look, I know you're just following the law. Connecticut is one of only 2 states left in the country. It is 2. I thought it was 1, but it's 2 that doesn't have.
I'm the one that said it was 1 last time. I got it wrong, but Massachusetts is in the boat with Connecticut. Yeah. Maryland is the one that got out last session.
Right, exactly. So, hey, we're working on it. And I, with renewed passion, attended the meeting yesterday to make some legislative change. But of course, we got to wait till after Election Day. But this illustrates it perfectly. This is a person who 6 weeks ago was restarting his life with every tool he needed to restart it. And everything has fallen apart. And to put him right, he needs detox and hospitalization again. And in a perfect world, to return to the Clozapine under which he was functioning so well and had full-time work. But right now, it's not his choice. There are other options. But to hear, I don't know, we can't put him in the hospital unless he wants to go. I'm just like, and I said, look, I know you need to follow the law, and I'm not yelling at you, but I just need to tell you that what right are you protecting? The right for him to harm his mother, the right for him to chase after my car and possibly cause an accident, the right for him to be evicted from this home and be homeless. This is what you're protecting? All right, that's my rant. Sympathy, please.
You deserve the rant. We have been there, and I'm excited about this program because it's how we got out.
All right. So with that said, our most listened to episodes, and Mimi and Mindy, you may not know this, the #1 episode most listened so far is with Dr. Amador. It's in case you're looking and you're wondering how to sort through the 107 episodes. Season 2, episode 2, we had Dr. Amador on I'm Not Sick, I Don't Need Help. That was about 3 years ago. Our very first episode, Who We Are, What We Know, How to Cope. That's the second most listened to episode. Another early episode in season 1 called Let's Talk About the Voices. What the heck is schizophrenia? Is very listened to as well. Getting help, low points, wild goose chases, and lifelines. That's also in season 1. Treatment Advocacy Center, Help and Tips for Families in Mental Illness Crisis is number 6. That's in season 3, episode 21. Our 7th most listened to episode, very close to the others, is this one. You've heard us talk, if you're a regular listener, all the time about Dr. Robert Laitman. There's a picture of me and Mindy me and Mimi meeting at one of his barbecues, and me and Mindy meeting at another one of the barbecues. Dr. Laitman has written a book called Clozapine, Meaningful Recovery from Schizophrenia. It has changed thousands and thousands of lives. And the only complaint we've ever heard is, why can't he treat more people? How come he can't take my loved one? And so we are delighted. And Rob, if you want to turn your microphone on to bring Dr. Laitman back and share, in case people didn't listen to the other episode, maybe just a quick recap of how you got to where you got, and a brand new, exciting plan to bring more meaningful recovery to more people with the help of a company called Doro Mind, named after Dorothea Dix. So welcome back, Rob.
Thank you, Randy. And I can't let your rant go without comment, because it's a perfect segue and why I'm doing what I'm doing, and why there is a collaboration now with Doro Mind. Again, when we're treating serious mental illness, to reverse my usual protocol, it's all about engagement first, and the lack of ability to get your loved one into treatment when he needs it. So, it's interesting. I was listening to the list, and the TAC is right in front of me, is appropriately positioned because you can't get to clozapine unless you get engagement. And E. Fuller Torrey and I have tremendous agreements on almost everything, but the one thing that we don't agree on, and maybe that's because I'm a wild optimist, is that someday, in terms of having tools, we'll have a national assisted outpatient treatment, court mandated treatment that's universal across the United States, that's consistent, that's rational. So in other words, when someone is in need of treatment, because some of the state laws are written beautifully, not waiting for that sick enough, that dangerous enough criteria, because again, part of doing all this is to get your kids into early treatment. In our movie, and you should mention our movie, Into the Light, and I'm taking every opportunity here to Into the Light,
Absolutely.
Meaningful Recovery
There's an episode on the movie, and we're happy to say, yeah, we did a whole episode on the movie. And so I will put that in the show notes. I think it was just a few, within the last few months, and we've had screenings of it, and they're beautifully attended, and we're very excited. Into the Light is the name of the movie.
Yeah, but there was a line from my friend Michael Orth. He said, it's mental illness, it's, how long does it take to get even the attention of the professional community? It's well over 10 years before, people are tootling along with their illness. And that's such a missed opportunity, because as we understand more and more about these illnesses, these brain illnesses, the earlier you get into treatment, the easier it is. Not that it's not impossible later on, but it's going to take more effort. It's probably going to be realistically not as complete, or as meaningful a recovery. Doesn't mean that you don't try. It doesn't mean that you don't forge ahead. It doesn't mean that you don't persist. But early and engagement, my two E's is part of my E's protocol. So the last, I think I was on in 2022. So it's been a little bit of time. There's been some water under the bridges. And, I've gotten to contemplate life a lot, because both my mother and my father, who were 99 and 101 years old, respectively, passed away. But, time marches on and I'm getting older. So I try to do as much as humanly possible. I believe in our approach, and I'm going to summarize very briefly. So the general approach that we use, we have an acronym because we've written a paper that's gone into the schizophrenia research literature. And basically the acronym is EASE. So early use of clozapine, assertive management of all the side effects, and also an assertive management of the patient, where you realize that it's not just clozapine that makes these kids better, it's the wraparound service. Slow, two words for that, or two processes for that. You have to go slowly when you're introducing the medicines to minimize side effects, but also slow in that everyone's got to take a deep breath and realize that they got sick over a long period of time, usually, because there's often a long, what we call prodrome, before the illness becomes absolutely manifest. And it's slow in recovery. And then again, back to E in engagement. So I was thinking, getting back to feeling old, and really just trying to, I'm only 67, so I'm going to be around a while. My dad worked till 96. What can I do? What can I do more? So the first person was my wife, obviously, Dr. Ann Mandel, and she's full-time doing this as well. But we can only take care of so many patients. So I started talking to nurse practitioners in the area and started to train them as well, because I just couldn't figure out who else would take a global approach. Who would do the medicine? Would it be internists that have an interest in psychosis? Would it be psychiatrists who could expand their internal medicine background and kind of get retrained, because in psychiatry, there's this artificial barrier where you put your patients over there and you say, you don't cross this line. And I find that the number one complaint a lot of my patients with serious mental illness have is they're lonely. They're lonely. And these kids need to be embraced. So last 2023, I got a cold call from these wonderful two people. I think it was Mimi Lou first and Brady Richards. I think it was Mimi alone at first, but I'm not 100% sure. And they said they have loved ones that have been affected by psychosis, and Mimi has a brother who is on Clozapine, and they've been in the medical fields and at rather high levels, and working with information technology and working with some fairly prominent companies. And I'll let Mimi tell you more about that. And they said, we've been searching the internet looking for a model of care that we think is the best and the most effective. And I'm not shy. I've certainly done enough podcasts and talks. And so they're all over the internet. They're all over YouTube. It doesn't take much. You just search my name and you search Clozapine and you come up with a variety of talks. And I stay on general themes and I expand them, and and I go through everything, and I'm not a man of a few words. Yes, I'm long-winded. But it brought Mimi to me, and then we spent basically the next year trying to figure out how we can expand access, because Ann and I are literally tired. We also have an 18-year-old dog that's like having a newborn at home, basically taking care of her in her last days. And so and Ann's got two elderly and their 90-year-old parents as well. So all this is about getting old and how the hell I can have a legacy. And it's not about me, it's about you guys, because I'm convinced after doing this for 18 years that this is the right approach. I talk to Ken Duckworth, at the meetings, and I drive Ken nuts because I say there really is a correct approach. Oh, no, there's many approaches. And I say, all I'm saying is take the most effective treatment, use it in the most effective way, be kind, be competent, be available. And how are we going to do this? And I had no clue how I could expand what I was doing. So Mimi came to me, and as I said, we've been brainstorming. I'd already started to train some nurse practitioners. We settled for now on the model of using very well-trained nurse practitioners to be our go-between between me and others, and for me to continue to supervise them. So let me introduce Mimi, who will tell you more about Doro Mind, because that's just the basics. Mimi, please.
Thanks so much, Rob. Yeah, I mean, Brady and I, we started Doro Mind about a year ago at this point, and just feel so fortunate that we came across Rob early in that journey. To be clear, we weren't looking for a clozapine-oriented care model. Brady and I come from a background where we spent our entire careers at the intersection of healthcare and technology. We're both engineers by background, and both actually have brothers who have grappled with serious mental illness. My brother was diagnosed with schizophrenia his first year of college. And so just know on a very personal level how difficult it is, even when you have everything in your favor, right? Came from families that had doctors and other resources to kind of excellent clinicians. We're really kind of, set up to kind of support our loved ones the best ways possible, and still really, really struggle. So, and then from a professional level, professional perspective, also spent a lot of time trying to figure out how do we leverage technology to really bring excellent care to a lot more people. We've done that in primary care, we've done that in specialty care, done it from the payer side, from kind of the technology side. And so seeing these themes around, hey, there are often these outliers where care is excellent and outcomes are excellent, but there are all these really pragmatic reasons why those models of care aren't getting to the majority of people who need them. And that's exactly what we saw here with schizophrenia and serious mental illness more broadly. So yeah, it really felt like I still knock on wood in how it's come together this past year, working with Rob and also Dr. Mendel and his wife. They've been just, I mean, the missing kind of shape in the team that we've kind of pulled together to really tackle this mission to make recovery the norm for people affected by serious mental illness. So very, very grateful.
So tell
Yeah,
us,
no.
tell us about the
a
plan.
Quick aside.
Go ahead.
A quick aside in terms of recovery. So my son Daniel, which is typical for most people with schizophrenia, is a stand-up comic. And it's a good career. And he's starting to bridge the gaps, and we're talking to other people in the fields and trying to bring in more people with serious mental illness. But he finally got into the Comedy Cellar, which is the premier comedy club in New York City. And he did that as a benefit with Mount Sinai. And it was a conversation with serious mental illness. And of course, I'm blocking on the name of the two famous comics. Chris Gethard was one. And if people know Curb Your Enthusiasm, it wasn't Larry David, but it was his co-star on stage. So to be a stand-up comic, just to know the level of recovery you need to have actually pretty fast processing speed because you have to interact with the audience.
Mm-hmm.
You have to stay on point. You have to memorize a lot of material because you're up there 10 minutes. And Daniel's a one-liner, so he has to memorize a lot of materials. But you also have to have a lot of working intelligence and a working memory that is fairly facile. And people need to understand that you can get these levels of recovery. This is not the norm. We're in one of our ventures, why I'm so interested in doing this is, and hopefully getting to people earlier and earlier, is we want people to return to real meaningful recovery, real levels of function. And I'll turn it over to Mimi, but that was just an aside for Daniel Laitman. And, I'm always advertising for my kids, so you can look up his comedy. He's all over YouTube as well. Okay, go on, Mimi. Sorry. That was just an aside.
I actually just, I don't think I've shared this story with Rob, but I have a similar experience where I actually have a grandfather who had a psychotic break early. In his childhood, he was kept from school. He basically fell apart when that happened. And it took one teacher to come to him and be like, noticed, hey, you're not showing up at school anymore. What's happening? And kind of removing those barriers to getting back in school that helped him achieve recovery. He ended up living till 100. He was a doctor for practice for much at that time. So like I've had SMI kind of sprinkled throughout my family tree on both sides. But knowing, personally that recovery is possible and having that hope, I think makes a huge difference. And so that's one of the things we try to do is think about Doro Mind. How do we bring that hope to more families, right? Because I think even in the clinical community, I would say Rob is kind of redefining kind of what people can expect, right, for their patients. And so, what we've done is basically pull together a set of services to really help families through that recovery journey, through the ups and downs. And I come right before Doro Mind, I was working in the primary care space. And the way we think about it is, we're that similar to primary care, that quarterback for families to help them sort of navigate that journey and provide, a really comprehensive set of services. So certainly medication optimization and medication management, right? Clozapine being a really great specialization. But again, we're more focused on what else also do you need on that recovery. We find a lot of families need, Randy, you mentioned Dr. Amador, but like there's a lot of skill coaching around communication, right? Because things will never go as expected. And how do you, I'm going to borrow kind of Rob's sort of recovery as a team sport ethos here and say, if you have not just the individual working with, you know, their clinical team and folks, but you have an entire family that needs to be part of that recovery. Teamwork is hard, even when when you don't have psychosis in the mix. So how do you provide some of those, you know, a full set of psychosocial set of services? So skill development, we have coaches that do that. We have, you know, I talked earlier about purpose for my grandfather, but this idea of, hey, how do we, you know, how do we make sure that you either stay in school or find a job or sustain that job, and have that purpose drive your recovery as well, I think is so crucial. So those are just a couple of highlights of kind of how we're thinking about what we can offer families more holistically.
So how, yeah, I mean, I'm asking all the questions. So Mindy, Mimi, anybody want to chime in? I'm just wondering, like, how do I get this, basically? Okay, what does it cost and how do I get it? And I will share, because we're talking a lot about early recovery, and there are probably a lot of listeners like me and like Mimi and Mindy, I believe, I don't want to, that we tried to get to this early, but there were so many obstacles that by the time my son went on Clozapine, he'd been through 5 hospitalizations already. So that means at least 5 psychotic breaks, probably many before. And he still did well on it. He was he hated the side effects. He refuses to go on it again because it wasn't properly administered. And again, if you want more information about that, all of that is in Dr. Laitman's book and in that earlier episode 4 years ago that Dr. Laitman was our guest on. You can check that out. It's season 1, episode 18. But from my personal experience, when my son went on it, even though it wasn't administered, he complained a lot about being tired and weight gain. But I was to a point where I was like, wow, I believe his brain is rewiring and repairing itself. That's what it felt like, because he went from 6 college credits to part-time work to 2 part-time jobs to being offered full-time work to getting off Social Security to driving a car where I felt like it was safe for the world for him to be. And this was not early. He was in his 30s when this happened. So with proper treatment, there is hope. I don't know if it would work again. I hold on to hope that it will. But
I just want to insert here to have hope, Randy, before we get to Dr. Laitman, who will certainly say there's hope. But as you know, and as our listeners that have been listening all along know, you and I with our sons have traded places in the course of this program. When we came on, you were in the stage where Ben was working full-time and off of Social Security, et cetera, as you just described. And we, the Greilings, were still in the soup. Jim was on Clozapine, but it was improperly administered, and none of the side effects were being treated. He didn't get enough, et cetera. So, but now, even after 16 years, when the FDA would not allow Jim to use Clozapine, he did really well on it for a couple of years, but they claimed he had agranulocytosis, which Dr. Laitman discovered looking at his records. He did not. But even after all that time, now he's doing incredibly well. So Ben hasn't been off of it anywhere near as long as Jim, and there's still hope. So that's what I want to say.
I have to segue on both of those again, then we'll let Mimi tell you how you can get Doro Mind. So I got another, not really cold call, because I'm familiar with these people. So over the last few years, I've surprisingly, to me at least, I've been embraced by a lot of people in the psychiatric community, and especially a lot of the researchers, because apparently a lot of the people that actually know schizophrenia and know the research want to use Clozapine. So I got a call from a gentleman who is doing his postdoctoral work at King's College in London. And he's working with a friend of mine, James McCabe, who's another friend of David Taylor, and all these guys over at King's College, because they're big Clozapine people over in England. And he called me up and said, Rob, would you like to be the moderator at the Schizophrenia International Research Symposium? It goes back and forth between Florence and Chicago, and I was honored to be over in Florence this past year and wasn't planning on going to Chicago because, no offense to Chicago, but it's not Florence, Italy. But I couldn't pass up the opportunity. And what they're doing is they're moderating the mechanism of action of clozapine, specifically with an emphasis on the immunologic properties of clozapine. And it's an important discussion because it comes back to what happened with Mindy, it comes back to Randy, and it comes back to why it is such a different animal than all the other antipsychotics. We always talk about, the chemical imbalance and, even we talk about the connections in the brains. But people have to understand that this illness is neurodevelopmental and neurodegenerative unless it's appropriately treated. And so much of that is immunologically based. And clozapine has these unique properties that allows, as Randy was saying, for that brain to repair. It dampens down something called the microglia, which are the immune cells in the brain. It changes the trajectory of the illness. And it's really the only drug, well, it's not the only drug, but it's the most effective drug at doing this. So when you also mentioned, the 5 psychotic breaks, every time you have, and I used to hate that term because people still have psychosis, but I understand what they're talking about with a psychotic break, the wildly positive symptoms where you're really, totally out of control, that dopamine excess, and that turns on the microglia as well. So all these drugs do, by dampening down that effect, have some disease modulating properties, which is why we always talk about getting people under treatment and duration of untreated psychosis. But clozapine is uniquely effective at this, just a totally different animal. And you're in the midst of another psychotic break, so you have to get them treatment. Ideally, you'll have to get this under control, and hopefully you guys will come to Chicago and we'll talk even more about the mechanism of actions, and hopefully that will be a further impetus. One other thing, as part of the segue, this November 19th, we're going back to the FDA, and we're having a listening session with the committee, for experts, and it's an advisory meeting. It's not the FDA itself, but often the FDA listens to the advisory meeting, and we're trying to change REMS. Some of us that are meeting there are trying to eliminate REMS. I don't want to eliminate REMS. I want to eliminate all mandatory blood work because the agranulocytosis that Mindy was, quote unquote, confronted with James is often not there, and people will take and misinterpret the data. And the incidence is so low that you're missing opportunities to start people. And, when we do medicine, it's always about benefit and risk. So I want to get rid of the mandatory blood right in the beginning, to get rid of the paperwork so that more people aren't overwhelmed by this crazy system of having to get blood every week before you get your 1 week of clozapine. It's a system, if you're dealing with someone with psychosis, that's doomed to fail. You're making it almost impossible to use the drug. So I want to get rid of that. But what I want to change the REMS for, because the pharmaceutical companies are invested in REMS.
For a new listener, just explain what REMS stands for.
Risk evaluation and mitigation of side effects.
Okay, thank you.
And they do the blood work to supposedly mitigate the risk of developing a very low white count. And right now it's set up where you do blood every week for 26 weeks, and then every 2 weeks for the next 26 weeks, and lifetime every 4 weeks. So the agranulocytosis is not the problem with clozapine. So I want to change the REMS to do what it's supposed to do, which is, risk evaluation and mitigation of side effects. I want to set it up as
good.
An educational site to help people optimally use clozapine, which is part of, or hopefully also will become part of Doro Mind, because we have to educate them. And, the more resources that we have, the more support that there is, the more that people will be able to use clozapine. Now, back to Mimi on how you can get this care. Sorry about all these asides.
Thank you. And for more about REMS, we have episodes with the Angry Moms, which you just search Angry Moms on our site. I will put the episode number in the show notes. And so people are chafing at the bit now. How do I get this? How do I get this? Do I need to be rich? This is Dr. Laitman and his wife said their legacy is going to be making this care available to more people. So Mimi, why don't you tell us more about this?
Yeah, I'm excited to share that we're serving families across all 50 states. So basically, if you live in the US, we would love to hear from you. We would love to help you. We're offering 2 types of services. So across the 50 states, we provide Doro Compass. So in Doro Compass, we work with either an existing psychiatrist and therapist relationships. And if you don't have those established, we'll help you find people who are open to collaborating and working with Rob's protocol. And then in certain states, starting with New York, New Jersey, Connecticut, we are also providing the care component. So we are prescribing, we're providing therapy, and more and more with Compass, we're trying to make it as rich as possible in terms of the services we provide, so that you can get all of those components towards recovery. So we've been, providing services for the past 6 months, have already gotten a lot of experience from working with families and a lot of wonderful, heartwarming sort of feedback around helping people transition to care. Some folks who are coming to us while their loved ones are still in the hospital, and they're trying to figure out what's next, getting ahead of that, or even while they're in the hospital, making sure that their regimen is, safe and consistent with if they've been on clozapine prior to hospitalization, how to maintain that in a reasonable way, and then kind of make sure it's really those transitions of care right between different points in the journey, that sometimes where things really get messed up, not because anybody's trying to do the wrong thing, right? But just because our system of care is so disjointed. I'm sure all of you have experienced that, right? I certainly have, for pretty directly. And so we're really hoping to be that support system, part of that recovery team with you, and really make sure that the things that we know ought to happen are happening at the appropriate points. In terms of the cost, for Doro Compass, we start at $500 a month, with Doro Care, which is available again in New York, New Jersey, and Connecticut. What we start at $900 per month. We do offer a sliding scale, so we try to meet families where they are financially. Quick aside, I will say we're trying to fund those grants and scholarships. So if anyone knows people who are interested in making these services more available, I'd love to hear from you. But we're doing that intentionally because we want to make sure that as we're building out Doro, it's serving, a very representative slice of, everyone grappling with this, with psychosis. And so far, we see that reflected, and we have a really wide range of families where they are, in terms of financial position, but also just really great to also see, we have some who are coming to us as individuals. You don't have to have family members to come to us and get care in our services. But if you do have loved ones that want to participate, we welcome and encourage that. So we have, mothers and fathers, we have partners, we have siblings, we have, a lot of different relationships that we're supporting.
I have a couple of things. One, just a PSA for the angry moms. I know that Rachel Strife was on here with Randy and Mimi when I was otherwise engaged with a political event with people up for election that are very good on mental illness. So I missed that one, but the angry moms, just FYI, they do support just totally getting rid of the REM. So we will, and doing the education some other way, so we can let them slug that out with our guests. But I'm wondering, how do you get these nurse practitioners, and what is Dr. Laitman's role in the oversight of what they're doing, that it's following the fidelity of your model?
Hey, Rob, do you want to talk about, go for
Oh,
it.
sure. So the way we have it set up, and it's, just what I was looking for was more work. But, as I said, I'm feeling old, and I really don't want this to die on the vine because, and Mimi addressed, there's two problems in the system, is access and cost. So the cost remains a problem, and I just want to put a word out there for some of our, hopefully, people that are working with insurance companies elsewhere. This is not, I think, even with a sliding scale, sustainable, unless we get insurance models involved. And I'm hoping to get, the really eventually CMS, Center Medicare Services, whatever CMS stands for, involved, because the problem is we have fragmented healthcare systems. And even though we know that Clozapine saves tremendous monies, there's multiple studies showing that it saves anywhere from $25,000 a year in the VA study, the study in England, £22,000 a year. And we know that the cost of SMI every year is, we're going to be releasing from Schizophrenia and Psychosis Action Alliance an update on the cost of not caring. It's closing in. It's not quite there, and I hope it never gets there, but it's $500 billion a year if you're going to factor in the cost of care and the cost to the providers and the lost care or the lost financials, just the financials. Forget about being a human and taking care of people. $500 billion a year we're just throwing down the toilet in human potential, and that doesn't include the suffering. So how am I supervising? What's my role? Well, we meet once, twice a week, formally, for an hour or two every day, and basically they run cases by me. And I hear about the cases and I stay involved in the cases. The model it's interesting because the model has been developed because I've spent the last several years since Zoom doing these 3-hour sessions on Saturday where people run cases by me. So I'm used to hearing the 5-minute elevator speech. I say, give me as much detail as you can. I need to hear the meds. And it's been doable that you can, even in these snippets of time, as long as you keep getting follow-up, make significant changes. And then what we've done is, when we're Doro Compass, we'll have special sessions, and we've done this now twice, where we'll actually get the psychiatrist involved with the patient and the caregivers. And I'll sit there and have a quick conversation, not quick, a conversation with them and, discuss what needs to be done. And, people, first of all, if they look me up, the first thing they still see is that I'm a nephrologist. But if the Google searches are starting to trend more towards Clozapine. So they see my training, and we're getting more acceptance in the general public. So that's Doro Compass. We do need to involve, because we're using nurse practitioners, and nurse practitioners have to be licensed in every state to prescribe. MDs can prescribe across the country if you're involved in mental health care. I physically and mentally really can't take on more. At one point, I was up over 250 patients on Clozapine that I was directly taking care of. And since that time, I'm down closer to 150, where I've, still stay involved with these kids, but have had them go to other psychiatrists, go to Doro Mind and all the rest, because my overall mission is to make myself available so that we have more and more of the nurse practitioners. Right now, it's, I think our peak month of my activities was about 8 to 10 hours, where I've had to devote just to Dora Care and Dora Compass. It'll be more, but I want to be available to do that. And the more we expand, the better it will be, because people talk about centers of excellence, but center of excellence, you always think about, oh, we're going to go to Hopkins, we're going to go to Harvard, we're going to go to Sloan Kettering if we have cancer. We live in a digital world, and we have absolute deserts of care if you're going to talk about geographic areas. This is a much better way of doing it. But again, the gorilla remains the finances. So access, I'm going to continue to train nurse practitioners. I have 3 others that I've had involvement with, 2 of which have family members that I've taken care of. Another one who was actually the first nurse practitioner is my office, but he's, Doro Mind is a startup and he has a very steady job now. So there is that risk that we could also die on the vine. I don't want that to happen. I want this to be a model of care.
Okay, so we have about 10 minutes left. And so I'm going to want to have Mimi Feldman have a chance to ask a question. It's early where you are on the West Coast, so you've been remarkably
She's
quiet.
in France, I think, right?
Oh no, you're home.
I'm in France.
You're still in France? Oh,
Yes.
it's late where you are. Oh, forget it. Okay.
No, it's just the afternoon. It's actually
The afternoon. Okay. All right. So, good.
I'm
I
the
know.
one
Siesta.
that had to get up early.
Okay. All
Sorry,
right. Well,
everybody.
I got my coffee here, though.
I just want to make sure that the average listener understands that you're working toward having this covered by medical insurance. It isn't currently covered by medical insurance. That's what I'm getting from this, right?
Correct.
And
Sorry, can I just add?
yeah,
Randy? So we actually have a lot of interest from payers right now to work with us.
Good.
I've done contracting of this kind in the past. I'm surprised by how many doors have been opened to us, in part because I think as easy and as fun it is to blame the payers in all of this, a lot of them actually want to do the right thing here. It's just there are some operational reasons and other sort of complexities to kind of funding care in the ways that we want to be seen. But I just want to say that we're making really good progress. Our hope is starting at some point next year, we're actually going to have payer coverage in the mix. We're just really early in this journey. And even before that happens, we have a VP of operations, Mina, who's tremendous. And her background is actually in medical
Neuroscience.
So that's Stephanie. We have another person on the team who's an amazing member as well, who's got a lot of experience working with families and a neuroscience background. Mina comes from, her first job was in practice management. So she has been incredible in kind of helping navigate, for example, out of network benefits and single case agreements, which are basically fancy ways of talking about even if we don't take your insurance today, we can help you access some of those benefits and covering these costs, which we're happy to help support. So just want to put that out there as well.
Right. So my question is, let's say I want you.
Yeah.
So what do I do? What website do I go to? What's going to happen? What's the intake like? That's what I think our average listener who's going, okay, I'm sold. What do I do? What's going to happen? Can you talk us through that?
Yeah, absolutely. Our website is a great starting point. So DoroMind.com. We have a really streamlined appointment request process. So that's a great way to get started. If you have questions, there's also a way to text us directly from our website, information about that, and also how to schedule a sort of more informational sort of call if you have questions for us before that initial appointment. But that is a great starting point. And if you can't find what you need from the website, you could also directly email us at hello@doromind.com.
Okay. So Mimi from France, do you have any questions or thoughts that you'd like to share?
Well, I just wanted to make a comment about the nurse practitioner thing. One thing that happened during COVID that I think is so positive is that people's minds were expanded in terms of the idea of using video and Zoom and all of that. To me,
Telehealth.
and we first met Rob with Nick right at the beginning of COVID, and we were going to go back east to see him, and then nobody could do anything. So we've done the whole thing by Zoom. Number one, I have to say that because Nick was 15 years into this and not in good shape when we met Rob, and Nick connected with Rob on an emotional and every level more than he had with any doctor he ever sat in a room with. So the video, well, of course, Rob would get down on the floor and do push-ups with him. So that was very different than whose office we'd been into either. But that was great. And then the other thing is, when you're in a small town like we are in Washington, there's not doctors and psychiatrists at your mental health center. You're dealing with a nurse practitioner. So the idea of having nurse practitioners handling the medicine, once they know it, it's fantastic. What a great idea. And I think that it opens up the door for so many more people to be able to have this, because they're not seeing doctors anyway, and the nurse practitioners come into this without all the preconceived limitations and ideas that psychiatrists have, which tend to not really work very well for people with SMI.
And there's physically just not going to be enough psychiatrists, and the psychiatrists that are coming out have this fixed false perception of recovery. And then if you think about it, they're not all, but a good number of them have also false beliefs on, the difficulty of managing things. Certainly the reimbursement for taking care of people with SMI, it's a tremendous amount of work and very little money, is not appealing to a lot of the people that are coming out with $400,000 in debt from medical school. So a lot of psychiatrists continue to take care of the worried well. And
the worried well.
SMI,
And, I think that we really have to start to think outside of the box with this stuff.
Absolutely.
When we started with Rob, Nick had a general practitioner, his regular doctor, and that was it. And we cobbled together a system with me running in between Rob and the general practitioner, because the general practitioner had to order the blood work because Rob couldn't order it from New York. And I mean, it was a lot of work that first year, but it worked. We did it.
Yeah, we did it. And again, why the NPs? Well, I have my prejudices because I have two daughters that are nurses, and I'm hoping they'll go on and getting their NPs, their RNs right now. But just my experience of being 42 years now in medicine, when I was trained, I realized who delivers the care. It's the nurses. They're the ones that are the hands-on. And I always treated the nurses that I work with as absolutely colleagues, equals. And they are, I just write a prescription or give a little direction, but they're the one giving the care. So I always found the nurse model and that's more to my approach of engagement and embracing and bringing into the community. And nurses really have much less of that barrier than I found with other physicians. And they're really open to doing the medicine as well. So not that some psychiatrists are not, and I'm trying to involve as many of the psychiatrists as possible. But there's two: one, not enough of them, and two, their training is not what it should be, and three, the nurses just have that right attitude, and that's kind of ingrained in the nursing approach.
So my final question would be, let's say that I am a nurse practitioner and I'm interested in this. Do you train nurse practitioners not only in the use of Clozapine, but in bedside manner? I mean, do nurse practitioners, can they contact Doro Mind and say, hey, I'd like to work with you? How do I get qualified to work with you? Is that a thing?
That is a thing. That is a thing. Yeah, no, and we have people that, if they're in the geographic area, I can't tell you how many times, and my patients are kind of used to this, I get shadowed. they just sit in the room. They're, you know, in the office. Claire, one of our NPs, was with me 8 months, twice a week, just being with me, seeing patients with me, and I would let her take the lead. And honestly, I'm not trained as a therapist. The NPs, especially the psych NPs, do get that training, and that is a benefit. I've read the books, how to do CBT, the DBT. I understand the concepts, but I'm not a therapist. So I think in certain ways, they're better suited to do this than I am because they can provide some more of the services. I try to befriend people. That's my approach.
Right.
And, you know, that's, you know, also anything that you can do to get a therapeutic relationship on top of everything is critical, because if you don't get that binding and that trusting, and it goes back to engagement, and it goes. So yes, NPs are welcome. And also go to our website, Team Daniel Running for Recovery .org, I think. I'm not even sure the name of I think it's .org. Team Daniel Running for Recovery.org. It might be .com, but you know, look it up. You'll figure it out. And you can get the phone number or the email for Jane Dworkin, and also for some of the other moms, Karen Breslin and so on. And they can set you up so that you can go on to the Saturday Zooms, because those are very useful. And I interact with people, you know, every Saturday. It's either myself, my wife, Rachel Strife, and Angel Brisbane, two other moms that have been part of Team Daniel for quite a bit. And Angela is going on, a mother of a child who's in our movie and featured very prominently, going on to get an RN, and in the, you know, ideally will be an NP available to you sometime in the next decade in the Kansas, Missouri area. So yeah, we want NPs. We want everyone. I want psychiatrists. I'll talk to anyone. You know that.
And is Doro Mind involved in this training of new people as well, since you're trying to leave your legacy? And if you're no longer here in 30 years, you know, what will happen
40,
then?
40
years. I was giving you 30. 40 is good too.
Stanley, it probably will be 40.
Yeah. So Mimi Lou, can you comment on that? And then we really only have about 3 minutes left. Can you comment about, can they approach this sort of training or interest through Doro Mind as well? Because Rob's schedule is quite full. And
yes, please reach out to us if you're interested. There's careers@doromind.com, the email, careers@doromind.com. We would love to hear from NPs, either with psych NP backgrounds or family NP backgrounds, because to Rob's point, individuals are falling through the crack between those two kind of areas of medicine right now. So we actually are happy to kind of train people up with the psych piece if they're coming from family or vice versa. We also have family guys, so folks with social work background or, you know, who are providing more sort of like supportive roles outside of the psych NP work. Peer support, if you have peer experience, we would love to hear from you as well. So absolutely, please reach out. I also just want to say, because we talked about the hybrid piece, so the virtual piece and how that can really kind of serve areas with higher access challenges. We're hybrid, which means that we provide a lot of our services virtually, but I just want to point out we do have in person for the New York, New Jersey, Connecticut, tri-state area. So where it makes sense, we also have the ability to kind of meet people in the community and have them meet some of our NPs in person. So I just want to clarify that in case folks are wondering.
And we do, and we will be interfacing, using a lot of the, especially the trained social workers. Eric Smith, I believe, has been on, and he, you know, we were just out in Texas together with Mindy Greiling.
Yeah, very good.
Finally said it right. With Eric, and he's very interested in joining the Doro Mind community, because one of the things that Ann and I envisioned when we did Team Daniel way back when was bringing all these groups together. And, you know, that was a grandiose plan because we're just a small charity. And I'm seeing that, Schizophrenia and Psychosis Action Alliance is taking a leading role. But people like Doro Mind in the community, the actual care providers, can be really critical for that. And I think they need to also, and they've been really good about this, going into the communities, going in and talking to the NAMIs, being at the TAC, because Daniel and I are going to be at the TAC conference in Washington, D.C. I think that's in February. I'm not sure. I have to look. I just got another post. So we're going to be.
Actually, it's in Maryland, I think.
Is it in Maryland?
February. There's one in March in Maryland.
Is there one in March? It must be March. Yeah, I don't know.
Okay.
I just got
Yeah,
another
not
email.
DC, but Maryland.
Close enough. But, in
Yeah.
that DC metro area. Sorry.
Wow.
But they show up. They're available. And again, if we speak with one voice, because ideally what I'm looking for is a model of care where it's funded, it's accepted, it's found to be cost effective, and it becomes universal. I mean, that's the ultimate idea because, I was always a physician for a single payer. This is the perfect example where it should be a global fee. This is not a fee for service thing. On a personal level, I'm thankful that I have intergenerational wealth because there's no way I could have done this over the last 14, 18 years. I'm, without exaggeration, making a third in dollars that I was making from 1995, 30 years later. So you figure out the math. So, and I charge a fair amount, but it's so much work. And I want to end it on this point. It's so much work to do Clozapine. But you know what? Serious mental illness is so much work no matter what. And if you do the work with what we're proposing and you stay engaged, and also what I'm hoping Doro Mind's going to help me with is that sense of community, avoiding that isolation. But you do the work, you can have a totally meaningful life. And the last thing, I want to brag a little bit. So for the last 6 months, Daniel, my son, because I'm changing the definition of recovery, is now in a meaningful relationship and has a steady girlfriend. And he called me up. It's still PG, and said, "Dad, I'm active." And I go, "Good, you're running?" He goes, No, I'm active. Oh.
Wow. Oh,
So
that is.
So, again, the level of recovery, the ability to have a relationship, a job, to be normal, to be the Daniel Laitmans, to be the Eric Smiths of the world. This is what I want for the rest of the community. And it's going to take a lot of work. It's going to take the financial structures changing. And people like Doro Mind, hopefully, we're going to have something in place before I hang it up and become an emeritus something or another.
In 40 years. And on that note, this is the note of hope that I needed. And as I've said many times before, I still dare to hope, even in the midst of crisis. And something like DoroMind.com and Team Daniel Running for Recovery, just Google it. You'll go to the Facebook page, you'll go to the website and learn more about it. The book is Clozapine, Meaningful Recovery from Schizophrenia.
No, actually, it's changed.
Oh, it has. Okay.
Yeah, because we're on the 5th edition. You're still quoting the 1st edition.
I took your bio
Meaningful
from
recovery.
Okay.
Yeah, it's meaningful recovery from schizophrenia and serious mental illness with Clozapine.
Beautiful. Okay.
And the 5th edition should be out by the end of the year, and it's a much improved edition. And actually, because I got some criticism from Jonathan Meyer, my colleague in San Diego, who was the second big book about Clozapine that came out. And he said, your book's nice, but my book is, evidence-based. It has all the references. So we decided to up the ante and put in all of our evidence-based stuff, really put in our reference. It's a much better edition. It's still meant for the families, but it's also better for the professional. So that'll be out hopefully before the end of the year, if not very early in 2025.
All right. And
Could I get in a closing comment before you close up?
I'll let you do the whole close, Mindy.
Oh, I don't need to do that, but I just want to say that I'm glad that Dr. Laitman, that you have people shadowing you. And part of the training and for your legacy, in case you do get hit by a truck, I hope you will make
I'm
videos
running
for
after this. Don't.
I hope you will make videos for Doro Mind, kind of like Dr. Amador does, because Mimi and I know, because our sons have you and we meet with you as well, that you have that magic elixir that everybody talks about who has you for a doctor, that is just an intangible that is hard to emulate when you're not you or your wife, Anne. And I think that has to be part of the education. If it's just a clinical relationship, which is the kind that Jim has had with everybody else he's worked with in the last 25 years, except for you, that doesn't do it for people as stubborn as some of our children, and certainly, Jim is a stubborn one. So I hope that can be part of the education as well. And thank you to both you and Mimi for what you're doing with Doro Mind. It gives me so much hope that more people will have a chance like some of us do.
One more thing then. So in memorial.
We're going to have to make this a 3-parter. No, go ahead.
I knew Randy would have to close out. I knew that would happen.
Final comment, because we're over an hour
this
now.
This is it. I know. In memorial. So you give me a lot of credit, but my dad, Morris Laitman, was a practicing clinical psychologist for 60 years. And, I grew up in a household where I never heard anyone yell or scream. And he was warm and empathetic, and he treated his patients like people, and his patients were at our house. And I thought this was the norm. I found out as I went to medical school, because originally I went to medical school because my father said, keep your options open, because I just wanted to be like Dad. And I wanted to go into psychiatry initially, but I didn't like the model. And I found internal medicine more appealing because I felt I was actually doing more and embracing people. This is in the 70s, guys. So we didn't have a lot of tools back then. So my dad always, the word is, you treat people like people. And he would just, he grew up as a Freudian, but certainly devolved from that, and psychodynamic therapy and befriending, he said, was a real important part of everything. And his patients became his friends, his dearest friends to the end of his life. One guy who is still alive was a month older than him. And for the last 6 years, Morris, hello, how are you? Still alive.
Thank you. Thank you so much. Mimi, Mimi Lou, just any doromind.com. And I don't mean to cut you off. I would love to hear more about your dad. He sounds amazing. Let's just bring it on back now to your new legacy working with Doro Mind. Mimi Lou, any final word before we say thank you and goodbye?
Yeah, I think we've talked so much about how engagement and trust in that relationship between Rob and his patients, anyone who's caring for your loved one and that person, is so crucial here. And so we think about that, but also what does it take to actually create an environment where that's possible? And that's where I think the payment model, so that people don't feel rushed, so they can take more than a couple of minutes, and they can take their time. So, the clinicians having the tools to support, Rob texts with his patients constantly, but oftentimes that is at odds with the sustainability for the treatment teams. And so that's also something we're thinking about at Doro Mind, is how do we build for scale so that this is sustainable and great, not just for the patients and families we support, but also for the team that we're building. And so I'm really excited for all the ways that we're kind of tackling this, not just, again, for trying to deliver the services today, but how we make sure that this is sustainable over the long run. So excited for all that's to come. And
all right, very excited for all of this. And thank you both so much for joining us today. Hey, thanks for joining us for this episode of Schizophrenia, 3 Moms in the Trenches with Randy Kay, Mindy Greiling, and Miriam Feldman, To get in touch with us or to learn more about our books, please visit our websites at miriam-feldman.com, mindygreiling.com, or randyk.com.